Good afternoon, everyone. I hope everyone's doing great. We'll get started in a moment. Great. Well, why don't we get started? It's 12 o'clock. It's great to see everybody on and really grateful for your interest in hearing about our budget and sort of our planning around this budget. And really are grateful for all the community feedback that we get to help us build and develop this important budget, which helps us develop our overall strategy and service provision here in Travis County. So again, welcome. Thank you for being here today. And if we could go to the next slide, please. Again, we will pass over this, but this is a beautiful Photoshop picture of me. Some of you have already met me. And again, just to let you all know, this has been, I've been now here at Integral Care about a year and 5 months, and it's been an incredible. Thanks, everyone. Sorry for the disruption. I think the connection, we were disconnected. But please, if you, while we go through this presentation today, if you have any questions, use the Q&A feature at any time, and we will answer questions at the end. So if you've got questions, please write them down and put them in the chat. Next slide, please. So who we are, I mean, most of you know who we are, but next slide, please. We are, we are called the Local Mental Health Authority at Integral Care and the Local Intellectual and Developmental Disability Authority for Travis County. We also, along with the service provision and responsibilities we have as a local mental health authority and a LIDA, we also have a network authority responsibility. So along with the services we provide directly, we also have a network of providers and services that help us connect other providers to further expand access and care into our community. And our goal, and one of the reasons I love this job, is we have a very simple purpose, which is to support all of these needs, not all over the state of Texas, but specifically in Travis County. And we will talk in a moment sort of how we're focused on the budget and how that budget and our own strategic plan informs our strategy to make that happen. Next slide. So the way we do our work matters to us too. And let me just kind of briefly talk about what our mission, our vision, and values are, but really more importantly, our mission and vision right now, which is our goal and our mission is to support the health and well-being of Travis County residents living with mental health challenges, substance use disorders, and intellectual and developmental disabilities. And this is an updated mission statement that we've had. And again, this highlights the focus on Travis County, but we also have some of our services that go well beyond Travis County. The 988 service that we have also covers 50 plus counties across the state of Texas. But our focus is Travis County and further expanding the network and access to care for behavioral health services. And our vision is mental health and well-being for everyone. And this is an update too from what we've talked about in the past, which is our vision was healthy living for everyone, but we felt that we should have it a little more focused. our goal in this community is mental health and well-being for everyone in Travis County. So it's a really important component of what we do and how we do this work. And the well-being part's really important to talk about because when we talk about mental health, we're not just talking about treating disabilities and people who are in crisis, but it's also helping people live meaningful, satisfying lives on their terms. And so it's really important that we continue to look at not just providing services to help people in crisis and treating disorders, but along with that, helping people live the kind of lives and meaningful lives they can with the services, behavioral health services we provide. Next slide. So some of you have already seen this, but this kind of gives you categorically some of the things that we deliver. We have over 160 plus grants that drive a lot of our funding, but there's some key areas of service that we have. And this one specifically is focused on our behavioral health and particularly mental health services. But as I mentioned earlier, we have services for folks that are in crisis and in mental health emergencies, mental health care and suicide prevention, drug and alcohol treatment, criminal justice services, and homeless services. But as I said earlier, we also have a role in coordinating and providing services for folks with developmental disabilities. And we also have that role as a network authority, where our job is also connecting and identifying gaps in service and things that we can partner more directly with someone who can deliver that service better than we can. And some examples of that are we have some specialized care serving specific communities, but it also is in areas like inpatient hospitalization, where we contract with a number of inpatient facilities to provide inpatient services and also inpatient competency restoration for those folks that have been in the criminal justice system. Next slide. So this is important because this also has been a guide since I've gotten here to think through where we provide services. Any of you in the community know where we deliver services is changing. Our community is growing. We have in Travis County close to 1.3 million citizens, and we continue to grow. Where people live and need services keeps changing. So our focus is to be able to reach people where they are in a variety of different systems and be able to scale out and build access so that everyone can have access. We know there's more work to be done in this space, but some of the things that are really important to know is that we aren't in one building and everyone has to come to us. Our goal is to be able to reach people wherever they need us. And this one picture is an example of one of the areas of focus that we've had this year and then into next year about expanding mobile clinics where we can go out to where people are. And so during the flood, we actually were out in Travis County providing services to folks through this van right where the flood occurred. We also are working with our homeless partners to be able to get access to care and treatment, and also looking to expand use of this in crisis services. So one of our challenge and our opportunity is to keep developing services to go anywhere where a person needs help, and break down as many barriers as possible and make it as accessible as possible. And that includes vans, but it also includes looking at where we actually do have sites and are we in the right locations to ensure that we're meeting the needs of all of our community members. Next slide. So this is another component, and again, this helps inform how we budget, how we build the staffing models to support all of our programs. But we have many programs that were 24 hours, including our helpline for anyone that needs immediate support. And this continues to grow and expand. Not only do we have our helpline, but we're also in the 911 call center here in Austin. And we also, as I said earlier, are a 988 call center provider for not just Travis County, but a number of other counties as well. So we're very proud of this, and this is an area of service that we hope to continue to expand and emphasize in our service provision. Next slide. So now I'm going to get into the numbers and some of the, but not quite yet. We'll get there soon enough. But what really the focus of this forum today really is about just talking about how what we've done to build out our budget. What are the intentional things that we've built into this budget to ensure that we're meeting the community's needs? And I'll also say that this is a work in progress. And while we have a budget right now, it's a snapshot in time. We hope to continue to grow and expand services because we know we're not meeting all of the needs in our community, not just in scope, but the types of services and in all of our communities. So we know we have more work to do. But this budget is a snapshot and actually in a way that we identify how we focus intentionally on our efforts to get this work done. Next slide. So just to kind of lay out sort of the groundwork of how we approach this and some of the challenges that we have as an entity. One of the things that's important to know is that we are, as an entity, can't actually determine the prices for what we do and expand or contract by taxing our community or getting increases in all of our funding sources. We have to work with some incredible partners to support us in getting this mission done. But we are not a taxing authority. We can't grow our own local revenue to be able to expand services. So we have to work with all of our partners to be able to do that. And we have some amazing partners here in town. The city of Austin, Central Health, the county, and the state are all part of this, our funding sources, and I'll talk about that in a minute. The other thing that this year has created some unique challenges is that there's a lot of uncertainty about what's happening at the federal government, right? There's a lot of things going on with the new administration, some areas that they emphasize, some areas of things that they don't emphasize as much. There's been major budget cuts. There's been a new massive legislation that affects pretty dramatically the availability of Medicaid over the next decade. And so these are things that also impact our ability and predictability around certain funding and sources. And I can talk about that in a minute. And as part of that really is this question around Medicaid and Medicaid reimbursements. We have to be very strategic about ensuring ways that we can ensure access to all of our community members, regardless of ability to pay. And as Medicaid reductions continue to happen across the country, we are impacted by that as well. The people who we serve are impacted by that. And the approach and how we deliver services, we have to be very strategic about ensuring access through. So I will talk more about that in a little bit. And local funds not being secured, all of our partners that we're working with are also working through their budgets. So right now we're hoping to have that a lot of that certainty before our final vote on the budget, which will happen August 28th, but that's still a work in progress. And as we know, and I started this off with, which is, we're very proud of what we accomplish here at Integral Care, but we know we're not meeting all of the needs. We're not just scope, but this type of service is needed. And that's an area of focus for us, and we'll never stop. We have to continue to do everything we can to meet all of our community's needs, and we know that we have a lot of work to do. So some of the other things that are challenges, which are when we're actually in a process of developing new programs, looking at things to help us be a successful and competitive service provider for long into the future. And one of the things we really have to look at is how do we meet the demands given the limitations that we've had from budgets and otherwise and resources. Looking at infrastructure improvements that we have to invest in, things that aren't as exciting to talk about, but are important to help us be more efficient and use the dollars that we have in a more wise and be good stewards of all of these public resources. So we're going to have to invest in the use of technology and other things that will help us become more successful. That also includes things like housing and property and building. Right now, we're in the midst of building a permanent supported housing program called Seabrook, and that should be finished in this upcoming year. But those are significant capital and infrastructure investments we are making. The other thing that's happening, as I said all along, is that while we have a certain plan about how we want all of our programs and services to go, we're in a very dynamic environment, both at the federal, state, and local level. And there's a lot of change going on. And with any of this, it's how do we effectively manage all of this change and continue to keep focused on the critical mission that we have in this community. Next slide. So I'm going to touch on this just briefly, but the thing that's really informing us going into the next 3 to 5 years is a strategic plan. And our board just approved our strategic plan, and we will be doing public forums going forward. So all of you are going to be able to, we're going to talk more in depth about our strategic plan. And so many of you were involved in informing the design of this. So we had a lot of community feedback that helped us build and design our strategic plan. And I'm going to just go through the general pillars. These are sort of the key pillars, the things that all will hold up our strategy over the next year. And all of these are interconnected. And I'm going to start, these aren't in any particular order, but I'm going to start with ones that I think particularly are of importance to our community partners. One is really this role that we feel that we have an important function in is to lead through collaboration and system connection. We do not have to be the provider of every behavioral health service, but we feel that we want to be able to help others and help us become force multipliers in the kind of services that our community needs in behavioral health. So we will talk more about this over the next year, but a lot of our work is helping coordinate with some of our other partners in this community to effectively and more seamlessly connect all of our services, do more and better to coordinate programming, and also work together strategically to tackle some major needs that we have in our community. The other is delivering on a full continuum of care. And we will talk about this in the forums, but we have a very specific, based on the feedback we received from many of you, on what an optimal system of care in Travis County looks like. And our goal is to be able to either deliver through us, but through our other partners, and also with plans to grow the full continuum of care, not just in the type of services, but to make sure that we're meeting the need for every one of our citizens. And I understand and completely aware that we have a lot more work to do in this space. There's a lot more that we can do to build and grow out the optimal system of care. And we're going to need all of your help to do that. But this is a full commitment that I have to ensure that we build and deliver and identify what an ideal system of care for someone who has behavioral health needs is in our community. And we know there's some challenges to get there, but that is our intentional strategy over the next few years. The other is to really advance accessible person-centered care for every community. So, every community in Travis County does not look the same. And so some of the work that we'll be doing with our staff is also doing more deeper dives, meeting with community leaders across our county to better understand where our gaps are, what are the specific type of services to ensure access, quality, and the type of services that people need throughout our communities here in Travis County. So a lot of work we'll be doing this year is inreach and outreach with our community partners. And this one, we would never be able to do anything here without a strong workforce. So with us, we're going to continue to work on strengthening our workforce, their well-being and their effectiveness. Because if our workforce isn't healthy, their well-being isn't, and they aren't capable of delivering on the services need, we're not going to be able to be successful. And as you see in our budget, this is by far the largest investment we have in our budget overall, which is our staff and the resources for staff. But along with that is also, you'll hear us talk more about what are the tools that we can do to improve their ability to deliver services. What are ways that they can become more productive? What are the tools like technology that we can use to help people deliver services in a way that people want to receive them? And so that ties into the next strategy, which is really looking at innovation and transformative technology and data systems that help us enable some of the work that we need to do. And that happens both within our organization, but how we link and partner with other community providers. How do we become a true system of care here in Travis County in a way that we can share information and help people experience and get the best set of services across our entire system? And that includes some investments in our electronic health record. It looks at new technology, as I talked earlier about our mobile clinic. If you haven't had a chance, we are going to continue to expand that fleet, but there's a lot of things that we've built into those vans that will make the ability to deliver services more effective and more efficient with the use of technology. And then last but not least, which is we need to optimize a financial sustainable model to deliver these services and be the best stewards possible of these resources that we have to deliver care. So that means along with delivering the services, we also have to make sure that we are delivering these in the most cost-effective way, in the least restrictive and most efficient way possible. And you'll hear me talk about the budget, but part of the work is also us doing things like really expanding some of the fundraising initiatives that we need to do to be able to help bolster and strengthen our capacity to deliver these services. It also means things that some of you have already shared with me, which is we're going to be investing in updating our website so that we're hoping over the next year, you'll see an even newer and even shinier looking website, but more importantly, one that's easier to use and ways that we can modernize the functions to make it a much more of a community tool than we have been able to already. So stay tuned for that. That's work that we'll be doing, and we feel that that's critical along with all the service provision that we do, the fundraising, and being good stewards of the dollars that we already have. Next slide. So when we start talking about what are the funding engines that help us deliver these services? I am very humbled here by the sheer amount of different funding sources that we have coming in to get this work done. We have a very complex enterprise here delivering these services. We don't have one funding source. We have multiple funding sources, and within those funding sources, we have different grants and different funding initiatives within that. So it is a very complex set of funding tools that we have to be able to deliver on the critical services that we're doing. Everything from the federal contracts that we get directly from the federal government, local agreements and contracts that we have with the city and the county, and central health, medical insurance. We have some fee-for-service. It's entirely fee-for-service coming from Medicaid. And in the state of Texas, we have 5 different Medicaid HMOs or MCOs that we work with, managed care entities, that fund and pay for services, all which have different rules. So we have to have a very sophisticated system to be able to manage all of these funding streams. As I mentioned earlier, state contracts are a critical piece of that. Private grants from foundations and donors, and philanthropy, as I mentioned earlier, which we're hoping to continue to expand and grow to help offset some of the critical needs that we have to deliver these services. Next slide. So when we look at the budget and the budget timeline, the one date that I just wanted to make sure everyone was aware of, our final budget, and we've had a finance committee of our board working on this for some time. Our staff have been working on this for longer. We've used the strategic plan that many of you have been informed to help drive the budget itself. And then really specifically, now we're at a point where we're trying to finalize the budget with some of the feedback that we received, and then be able to present for final approval to the board on August 28th. And this is not any different than sort of the pathway that we did last year. One of the things that we're hoping to do, as one of the exciting things we've had this year, we've added a new CFO here, which you all, if you haven't met, Rusty's fabulous. He and his team are also working to modernize the system so that we can be further and even more transparent with the sharing of information. Next slide. So just to give you a little bit of feedback and just some of the key local appointing agencies, and the appointing agencies, just to be clear what that is the our board is made up of appointees from these three entities within Travis County. One is Central Health, the other is the City of Austin, and the third is Travis County. So these are the folks that appoint board members to oversee Integral Care's board, and their job is overseeing and approving our budget, our strategic plan, and essentially hiring or firing me. I hope they keep hiring me, but for now, that's their key role. And these appointing agencies are critical in funding our services that we deliver. And this list under each of these is not exhaustive, but these are some of the key things that each of these entities help support within Integral Care. And some of these are across, we get funding from all three entities to help support some of our key and critical services. So we are incredibly grateful for all three of them. And again, as I said earlier, they're all finalizing their final budgets. Some of you know what's going on with the city budget. There's still a lot of discussion about where that budget will land, the county and Central Health. So while we're putting together our budget, we're still working with them to get final numbers, final clarity, be sure what's included in each of these budgets, and ensure that we get full coverage and support to be able to deliver on our service provision. Next slide. So here's the numbers. It took me this long to actually get to talk about numbers with you all, but that's okay, because all that other work informs how we built this out. But first and foremost, just to give you again a slice of where the main sources of revenue in this budget. And so the last slide sort of highlighted the first three, which is Austin, Travis County, and Central Health. The last four on this, I just want to kind of highlight, which are really critical. When we talk about Health and Human Services, which is the TXHHSC, that's the largest actually bucket of funding that comes into Integral Care. And that 67 million comes from a multitude of different grants. So this is not one funding source. It's not fee for service. It's a variety of grants. And as I said earlier, we're drifting towards about 170 separate grants that we operate within Integral Care, each of which have specific requirements, data outcomes, accountability for our line items in the budget. So again, think about some of these funding sources also have very specific things that they ask us to track, follow, and deliver on very specific clinical and operational outcomes. And the money from HHSC doesn't just come directly from the state of Texas. Some of these are federal dollars that the state of Texas is able to leverage and draw down into its budget that then we work with them on funding our services and programs. We have other state agencies beyond HHSC that we actually get funding from. Direct funding that we get from the federal government is about 14 million, and that actually has dropped this year. Same with some of our dollars directly coming from HHSC that were federal dollars. We did see a drop off in ARPA funds that the federal government cut last year that are not included in this year's budget. The other thing that's in this budget, this last acronym, or CCP-DPP, is what we call our charity care pool. And within that are dollars that because we're a certified community behavioral health center and we're a local mental health authority, this provides some services that aren't otherwise funded or underfunded, or people who are uninsured. And so the state of Texas establishes a charity pool for all of the local mental health authorities across the state, and that we get a portion of those dollars that others are also drawing down on. And this is important because I said earlier, as we talk about Medicaid dollars, we have, and the potential trend in Medicaid dollars dropping, we're going to see more uninsured folks or folks who are underinsured wanting to access our services, which means those dollars from this charity pool become even more important. And this is an area of risk for us when we look at what's happening across the state, because we expect more people across the state of Texas who need these services, but there more folks are going to be uninsured. So we're hoping that we can continue to advocate for this to grow, but the budget for these dollars has not increased over the past 2 years. And so it's an area of focus and an area of advocacy that we need our community folks to continue to support, because I think we're going to see a growing number of uninsured folks in our community, and we need to find the ways that we can reach them and ensure that they're getting access to care. Next slide. So as I said earlier, one of the things we are seeing is actually this budget, our overall revenue number is less than it was last year. And again, that has a lot to do with some of the federal reductions in funding specifically. But we're, as always happens here at Integral Care, when one door closes, others open. So our local partners have really been incredibly supportive, and we're grateful. And that's really helping us continue to grow. So where we've seen drops in the state revenue, we're also seeing upticks in our local partners. We are incredibly grateful to be in this community where there's been a commitment to continue to expand these critical services. So when we talk about the expense budget, as I said earlier, we are a human service agency. So the vast majority of the dollars that we spend goes to staff costs. And again, to give you a sense of scope, we have close to a little under 1,100 employees doing a wide-ranging set of services and programs that I mentioned earlier. And we also, as I said earlier, are continuing to invest in our workforce. And I'll talk in a minute about some of the other things along with salaries that we've invested to help the mental well-being of our staff and ensuring funding and support for them to be able to deliver this critical work. Because, as I said earlier, we can't do anything without our amazing staff. The network authority role is, again, as I mentioned earlier, where we are managing a network of existing services and providers. And as I said earlier, things like we fund inpatient beds, that those dollars come to us through the state and through our local partners to be able to fund specific services that then we contract directly with providers in our community to deliver. There's also a range of developmental disability services that we do as well and contract with, and specialty care. And we're hoping to expand this. This is an area, again, we think is really vital to our success, not just necessarily what we do, but how we can link and partner and support those in our community who are doing amazing work that we can help support and maintain those services in our community. Client support, which is everything from food, medications, and other things that we provide many of our residents in our residential program and across all of our programs and services. Facility and infrastructure costs. These are things like, as I mentioned earlier, the permanent supported housing program. Updates to things that aren't as super fun and exciting to talk about, like repairs on our buildings, IT and technology investments. And like every industry and every business, these are areas that we need to invest in to be able to improve the efficiency and how we do our work. But it also means that we also look very carefully about where we should be investing these infrastructure dollars, not just in bricks and mortar, but in other things like the vans that I mentioned, or new electronic health record tools, things that will help us improve our access and our treatment capacity. So, and then the last is some capital that we have beyond infrastructure for expansion and new development of new projects, some of which are in the infrastructure category. Some of those we've separated out. So overall, that's our budget for now. This is a snapshot in time. And we, again, compared to last year, it is a smaller budget, but it's a mightier budget. And we expect over the year, and as things grow and expand, we do our budget does grow and change over time. We're hoping to expand in certain service areas. We also are looking to continuously look at delivering services in different ways. So this number will invariably change, and we hope it will grow and expand. But as you heard me say in the beginning, we're in turbulent times with how funding is going, what's happening at both the federal level and the state level around our governance and funding. And we will respond, but we also need to manage to be here and continue to grow. And that's something that we've had an amazing board, we've had amazing community support to do and to grow, and Integral Care is well positioned to do that. But we have to be smart about how we spend our dollars. Next slide. So again, when we saw, I talked about the challenges in the beginning, but there's so many opportunities for us to be able to expand and deliver services. You heard me talk about the strategic plan. That in itself is helping us focus and really look at how there are gaps in our community, what services are missing, how can we grow those, how can we partner, and the budget is a way to help us focus and be more intentional about those efforts. We talked about convening and partnering and being a trusted connector to others who do this work great already. We do not have to be the provider of all of these services, but we also need to widen our network so we make sure that we're effectively partnering with people who are doing great work in our community. Deliver and innovative programs and services. So other than just doing what we're doing now, we expect to look at best practice, evidence-based models nationally, and partner to be able to create new and innovative services that help us further reach and deliver on the needs of our community. We have an opportunity to really build a culture here of philanthropy and supporting and having our community support these incredible services to be able to meet the needs of all of our citizens. One of the things we're going to do more of, and we both budgeting and time and effort, is increasing the visibility and community engagement around what we are doing. And so, as I said to you earlier, this is a Zoom call, but we're going to be doing more in-person and community meetings to be able to highlight what we're doing, hear feedback on what we can do better, and then also identifying how we can be more effective and good partners with our community leaders. And then again, this is not last and certainly not least, but continue to invest in competitive benefits and workforce development. Along with wages, that includes how we support our staff learning the critical skills they need to deliver this service effectively. That includes everything from clinical training, but also management training work that we're doing, and also the use of all of these new technologies that we're all hearing about every day. We have a commitment internally to start training our staff and leaders and expanding our use of AI and other new technologies. We're already doing it, and we're already using those tools, but we're going to further expand that to be able to deliver on these critical services. Next slide. So I'm going to go through this quickly, but just to give you a sense about some of the things that we're doing for our employees and we're continuing to do, along with as we develop the budget, we certainly want to be supportive of providing competitive wages within what we can do from a budget perspective. But we also are looking at expanding things that help our employees be better and stronger at the work they do. Everything from new wellness programs to employee assistance. We're also doing things around health benefits, around health savings accounts, looking at more affordable healthcare coverage. And then investing in some of the things that I just mentioned, which is also looking at areas where we need to shore up and make sure that we have enough staff to deliver on overnight and weekends, crisis residential, and we've added additional dollars to support that. As I said earlier, professional development is a really important ingredient to us being more effective, more capable as a workforce to deliver what you need in our community. Next slide. So, again, when we look ahead, I mean, I don't want to overstate this, but we have a lot of change in both the funding sources that are happening at the federal level, what's happening in our environment. And so as we have built this budget, we are going to continue to explore other sources of revenue to help us increase and expand services. The only reason we have a budget and the only reason any of us are here are to deliver services and to be able to make sure that our community's needs are being met. And we have more work to do in this. We have more resources that we need to build to be able to further expand the optimal continuum of care for behavioral health in this community. And we know we have a long way to go, but I'm very proud of what we've accomplished here at Integral Care, and know that we have your support to be able to further expand and make sure that we're meeting everyone's needs at the level and service need that they need them. We have to do this within a context of balancing this budget. We don't have the luxury of funding, doing things without proper funding. We are not, as I said earlier, while it is a large budget, it comes together with a lot of ingredients to make this incredible recipe, which is incredible Integral Care. And we have to do this in a balanced way and be fiscally conservative and responsible to be able to deliver these services. And as I said earlier, we want to be able to both provide employees with tools to be successful. And more importantly, we need to be able to deliver on tools, things like we've done for this community over the past few years about expanding mental health first aid and other tools to help our community be successful. Next slide. So again, what we could use your help with is to continue to support our mission. One of the things that, and again, I'm still a new guy here, and I'm still learning our community, but I still, when I go out to meetings with folks, not everyone understands who we are and what we do. And I need your help. So part of what we need to do is make sure as we build and promote what we do is word of mouth about what we do and how to access care. You being good ambassadors to help promote those services. And we also, independent of Integral Care, overall ensuring that we can promote investments in mental health services, because historically mental health services have been underfunded. That's nothing new. I would hope that we would be able to triple the amount of services we provide in this community. I think we need to further expand. We don't need to do those all ourselves, but we need your help to help promote the importance of mental health services and what it does and improves the overall health and well-being of our community. Next slide. So again, stay tuned. As exciting as a Zoom meeting is, we're going to hopefully do some in-person community forums. We'll likely do some forums, but also do some within specific communities, along with a wider community forum that we'll be talking about strategic plans, programs, that ideal system of care that I just mentioned. All of those are going to be really important as part of our discussions with our communities. Next slide. So here's, we have a little bit of time for questions. And if there's any questions, I'm happy to answer them. And again, don't feel this is your only chance to ask. If this doesn't work, we'll find other ways to reach and connect with you.
Hi, Jeff. This is Natalie. We have some questions. The first one is most of Integral Care's funding flexible?
That's a great question. And the answer is no. Our funding is very specifically earmarked for, as I said earlier, a lot of these are grants, right? And they're grants that are funding very specific things. And within those grants, there's very specific contracts that we have to deliver these services in a very specific way. So flexibility we have a lot of opportunity to improve that. And so, that with more flexibility allows us to use those resources to support where we see growth that goes well beyond an existing budget. And we're hoping to continue to expand the flexibility, but we don't have it as much as I would hope to have it here. Most of these dollars are identified for specific services and specific programs. And so we continue to work on that with all of our funding partners, but it could be a lot more flexible. Good question.
Our next question is, how will your housing and homeless work be impacted with the given restraints in the city budget?
Great question. We're still trying to find that out. I mean, part of the work that we would love all of you to do is I think the city is looking at an increase in um, asking our citizens to make a further property tax commitment to be able to support their budget. Um, the way that budget is built, the city council is still working on that and establishing a priority, and also at what level they're willing to fund our current initiatives. Um, I would say, the the priority for homelessness is a definite one that both the mayor and the city council have supported. There are other programs and initiatives that we have in this budget that we also are eager to have them continue to support. We've done our best to educate and inform folks on it, but anyone in this call, I would be thrilled to see you reach out to your council people and to let them know how important mental health funding is to you. But homeless services in general, because of some of the federal changes, we're all being very mindful about what and how that's going to look in the city budget. So we don't know yet, but we're hoping there's a commitment at the city council level and our community to further invest in these services.
We have another question. How many mobile clinics do you plan to provide?
Yeah, I've only been showing you one, but my vision is that we will have a fleet of these vans. Our goal is to build at least 5 to 6 mobile clinics over the next couple of years. We have another one on the way, and we're hoping to further expand those as we refine the use case for each of these. But so far in our internal conversations, we've discussed the need for at least 5 to 6.
Can we get our local funders to commit to long-term funding?
Oh, whoever said that, thank you for that question, because part of the work that makes our job very challenging is, when we look at the important need for things year over year, it's hard unless we have long-term commitment, both in the funding, but also to match things like inflation and other things that allow us to invest in salaries and support for our staff and in our programs and services. So this is an ongoing advocacy need that we have. Um, Long-term commitment allows us to do long-term planning with these services. Short-term commitments don't allow us to have a long view of any of the programs that we are funded that way. So we're constantly looking for ways to bolster and ensure that we're not losing funding. That doesn't help us do the long-term progressive planning that all of these services deserve. So it is work that we need to continue to do. And some of it has a phenomenon of the funding sources, but some of it is also continued education we have to do with many of our legislative leaders and our community to know that if we're fully committed to helping people remain in housing and not homeless, we need to not just fund the housing itself, but the ongoing and support for people for staffing costs to make that happen. So great question. Thank you.
We have one last question. How can the individuals in the community help with Integral Care's fundraising?
Well, stay tuned. We're going to be doing a lot more sort of fundraising events. But if you have thoughts or ideas, we are now embarking on, and one of the investments we've made is expanding some of our philanthropy staff. So we have added an additional position to be able to do major gifts, but also to expand on events and initiatives. And so if you have ideas, we'd love to hear them. But other than direct ideas about philanthropy, really getting the word about us, helping people understand our budget and how these services are so critical to our community. Typically, we only hear when things haven't worked out in mental health, but there's so many critical needs that mental health supports, the overall health and well-being of our community. You saw during the floods how critical it was to provide mental health counseling, and Integral Care was there and supporting folks here and in Kerrville to do that stuff. So we play a role in so many different ways, and we could use everyone's help on this call to sort of advance the importance of this mission, not just because it's a goodwill thing to do, but because it makes our community better.
And we have a similar question. What are some of your ideas for philanthropic funding?
Yeah, I mean, I think what we're going to be talking more and more about is looking at both the ways that philanthropy can support things that otherwise wouldn't get funded or supported through some of our existing grant dollars, to do things and to look at very specific projects that we'll be building out. But I mentioned one of them right earlier, which is we need to be able to fund this fleet of mobile clinics. That's Right now, that's a critical one. And this year, we've had some really good success by having some of our philanthropy community step up. And we've had both of our vans fully funded through philanthropic efforts and commitments from our community. And so there's specific projects, there's new initiatives, and there's also things that we want to be able to do to support our community through supporting the individual needs of the clients that we serve, and also ways to further advance and train and support our incredible workforce. So, and we'll be talking more as we lay out the strategic plan and with some of our other partners, some really other initiatives that we want to grow and build for this community that go well beyond integral care services that we would desperately need our philanthropic community to support. So specific projects, supporting our existing operations, supporting our consumers, and supporting our workforce.
Those were all the questions we received.
Folks, thank you so much for your time. And I can't tell you how much I appreciate you and your interest in what we do and what we're about. And the questions that you've all asked about how you can further support us. Your help and your support are critical. These services are more important now than ever. And so I just want to thank you all for your continued dedication and support of services in our community. And thank you so much for supporting our staff. And those of you, let me know when it's actually going to go below 100 degrees in August. I'm looking forward to that too. So really, thank you all for your time and your commitment today.